So what I wanted to talk to you a little bit about today is just about really what is a chiropractor and what is it that they do and what are their capabilities. So many times they put us into a box of just back pain, and we're going to explain to you today how chiropractic can help with a whole host and array of different problems, both neurological, chemical, emotional, all kinds of different things. So get ready, because we're about to go into this in detail. One of the main questions I get oftentimes through email or people will get a hold of me through the phone. They'll ask me, I have trouble getting to where you are in Austin, Texas. Do you know anybody who does what you do in other places? And unfortunately, what I do is there's not a whole lot of doctors of chiropractic who do this. Applied kinesiology is the kind of technique that we're using, where we're using the body's own muscles and intelligence to help us actually get to what's causing the problem. And it is absolutely amazing how wonderful a technique this is. It really helps us to locate what the problem is, whether that problem is a physical problem, it could even be a chemical or an organ problem, and even helps us to locate areas of emotional travail that can be causing some issues as well. So those are all in our capability of doing this. So, but my suggestion to you, for those who can't make the trip, I'd love it if you could come out and see us in Austin. We'll make sure we take great care of you. But if not, just do a Google search, any kind of search for Applied Kinesiology. Those that may give you a doctor within your area that is skilled in that particular arena, and I would recommend that. So one of the things that I wanted to share with you guys today is one of the very first things I do with a patient in my office. And I usually do this especially with patients who don't have any experience with chiropractic, but even those who've been going to the chiropractor for a long time, oftentimes the doctors that they've been seeing never really explain to the person what a chiropractor was or what it was that they did. And although they may love chiropractic, they may have kind of a very limited view of what a chiropractor is and what they really do. So this is Miss April here, by the way. We're gonna be working with her in a few minutes, but before we get on that, I'm gonna use her body just to kind of demonstrate a few things about what chiropractic is. So we've got April's, of course, brain right here, right below all that thick skull of yours, right? And it's the extension of that brain is actually what we refer to as the spinal cord. Most people don't think about that as your brain, but it actually is just a growth of your brain that extends down all the way down through the spine. And there's a big hole in the spine where that goes down through. Now, in order for the brain to be able to communicate with the body, it grows other little branches off of the spinal cord that go through holes in the spine, and those go to different junctions, and then lots of millions of nerves come out of that. So our body is just like this neurological, electrical thing that's happening all the time. And for instance, there's nerves that come out here and they go to the eyes, which enables us to see. And there's nerves that come out here and they go to the thyroid gland, which helps us with our metabolism. These other nerves up here go into the sinuses here, and they help to normal sinus function to happen. Of course, the ears. There's nowhere that you can pick that they don't go. So these nerves actually even radiate back up into the head. So somebody who's got nerve interference here in the neck, if it's putting pressure on those nerves, they could be prone to having headaches. There's other people that it could affect their eyesight. We've had lots of patients say, since I've been coming to see you, Dr. Echols, my eyesight has improved, or my night vision has improved. That wasn't the object of our treatment. It just so happens that when you start taking pressure off the nervous system, wonderful things can happen. And often, it happens so many times in the practice, somebody will say, since I've been coming to you, I don't have any stomach problems anymore, or something else is going on. And that wasn't the reason they came. It was just kind of an additional benefit. Because when we start taking off stress off the nervous system, then the body can actually work. We have a really cool saying in chiropractic that the body doesn't really need any assistance, but it can't tolerate any interference. And when our spine is interfering with the normal flow of intelligence throughout our nervous system, we've got problems. Let me give you just a brief example. I had a young lady who probably was about your age. She came in the other day, and she hadn't had a menstrual cycle in over a year. No menstrual cycle, no getting pregnant, no babies. And of course, a bigger family was on her agenda, but she hadn't had a cycle in a year. Well, I know that the lower spine, the nerves that come out of that go to the ovaries, the uterus, the fallopian tubes. The whole reproductive system is actually controlled by the nerves that come out of the lower back. We gave her several adjustments, and within a very short time, she spontaneously started having her cycle again. And fortunately, she was very happy about that because she definitely wanted to go on and have a family. So that's just a kind of an example about what we do. So don't get into the paradigm that chiropractors are back doctors, because we're not. We just work with your nervous system. It just so happens that most of your nervous system is in your body. And that nervous system, like I said, goes out and it innervates every single cell of your muscles, your tissues, your organs. So it's very broad. People that are having interference here could end up having stomach problems or digestion, heartburn, gas, bloating, liver disorders, constipation as you go further down. All kinds of different things can happen as a result of that. So this is all, you can all look this all up in Gray's Anatomy if you want to go to the trouble of doing that. There's a wonderful little chart in there that shows the relationship between spinal misalignment and all of those issues and conditions that I just mentioned. So the takeaway from this is don't put chiropractic in a box of it's for your back or your neck. It's not. This is a technique. It's an art form. It's a science that helps can take care of the whole body. So in the next video, we are going to have April here with us, and I'm going to actually show you how I would go about helping her. She's been having some shoulder problems, and we're going to kind of walk you through step by step how I would go through that in my office. So thank you so much for tuning in and watching, and we'll see you in the next video.
We at Wellness Plus specialize in all things health and wellness, ranging from yoga and fitness to massage and ASMR. Whether you are looking to target specific areas of tension or want to enhance your general self-care routine, we provide the tools you need to feel better, look better, and live better. We have courses for every level, whether you're just starting out or you're a seasoned pro. Our courses provide a wide range in difficulty to accommodate your evolving flow. Wellness Plus is available on Amazon, which you can stream from your home on your phone, tablet, or TV. Join Wellness Plus today and get your first 7 days free.